My grandfather lived very independently for a number of years. After fracturing his hip at 81, was shortly thereafter diagnosed with COPD. A few months after this, he was diagnosed with dementia, and this caused a lot of difficulties organizing all of his medical documents and coordinating his care. So as a young caregiver, I would say that the healthcare system is a big and difficult system to navigate. When we'd receive conflicting diagnoses or prescriptions from his specialists, it became really difficult to decide whose advice we should take over whose. For example, he would be prescribed water pills, but then told to reduce his water intake. He was told to reduce his sodium intake and then to increase his water intake. After he developed some infections, it got even more complex when he was prescribed antibiotics that conflicted with some of his other medications that he was taking. An integrated healthcare system would be one where I could go to a professional, receive a diagnosis, and then receive care almost immediately after. I wouldn't have to speak on somebody else's behalf, and I wouldn't have to get so many people to advocate for me.